Do we need to approve the?
Nope, there's just, we want to report on this on a quarterly basis, y'all know about it.
As you mentioned before, the changes are very minimal.
Yes, just wording.
Syntax, wording. These ones you need to approve.
Yes.
Can you make a motion?
On one of them.
Okay, I move, is this the copy? Quarterly patient experience report?
No, there's a quality plan and then an infection control plan.
It's the A.
The A?
Yeah.
Yeah.
Infection control.
Or one and two.
One and two, okay, I move to approve the changes in the annual infection control plan, or to approve the annual infection control plan as presented.
Second.
Motion by Elsa Libber, seconded by Justin Cook to approve the infection prevention plan 2020. All in favor? Motion carries. Now we need one for the quality improvement plan 2020.
Justin,
I'll make a motion to approve the quality improvement plan as presented for 2020.
I'll second.
Okay, motion by Justin Cook, second by Larry Richardson to approve the quality improvement plan 2020. All in favor? Motion carries. Next up is the quarterly patient experience report.
Okay, so inpatient rate and inpatient recommend, we did see a drop in the first quarter. I know I reported last month to y'all that we had high agency use over the winter time. I can now excitingly say that we are fully staffed on med-surg now with our own Conley people. No more agency contracts. Lydia has worked very hard on nights, even spent a lot of time between her and Valerie, our quality person, quality director, working to orient them on night shift and make sure that our night nurses are invested and trained appropriately. So we should see a trend back up now that we're getting started with our own Connolly core staff back on night shift. That did impact us because, you know, they're agency nurses. So everybody is off of orientation now, and we're excited to get them started and being full-time up there and working together. We put some other resources in place with ICU and ER to kind of bond and make sure that they are successful at night and feel comfortable here as as new full-time employees. So, like I said, we'll be working hard to get that going back up. ED overall, we have seen a trend back up from the third quarter, so from 44.5 to 53.1, so I'm excited about that. Have had a lot of positive comments on Viveris lately for, especially with seeing almost 1,200 patients this past month. So staff was able to keep up and keep them going and try to keep the wait times down. I think our average is still a little over 2 hours for, you know, the whole patient experience time. So pretty impressive still when you're going through busy days. And then surgery, we're at 63.2. Had a little dip and also had a little dip in surgeries last month. But Ray's checking into that. We didn't really have any bad comments or anything like that. I think it's just more of scripting with them. They have, usually everybody has good things to say about surgery. We just need to get them to put the 5s and put the comments on the surveys. So we'll be working on that one as well.
And on the clinic system, we did drop in about a point in the overall clinic system, and most of that was accessibility to our family practice areas. Right now we are weeks out in all family practice with the physicians and the nurse practitioners are getting full. So we've seen some issues and most of our complaints are about accessibility. On the family practice side, we're flat, it's a 60 here and a 61.4 here. On specialties, we dropped a couple of points. I'm not too sure. We didn't really see anything in the comments that kind of spoke to dropping a couple of points in specialty. And then in our urgent care, we did see a drop from 55 to 48, although again, it doesn't really speak to the comments that we've been getting. We've been getting a lot of positive comments from our urgent care facilities. Even though we've been seeing patients, we've been in the 40s and 50s, our wait times have been appropriate. Patients have been getting seen, they've been getting treated appropriately, so I'm not too sure why the dip in urgent care, customer service, but we're going to continue to dig into the data to see why patients were unhappy there. But overall, in urgent care, we've been getting just positive reviews, through social media, when patients have called in. And even the comments of the patients who have filled these out are good. So I really don't know the reason for the dip.
These are top box scores too, so if you don't rate us a 4 or 5, they might have great with the doctor, but the wait time was exceedingly high, and we saw 50.
Yeah, we've been, there've been high numbers.
Yes,
and
been
so
very
there's
high
been
numbers.
a bit of a wait time, but even the wait times in urgent care haven't been bad.
The staff have been really good. We visited them on numerous occasions, and it's been very upbeat. And, we've seen social media too, people recommending to go to the urgent care because of the access. And if you have a cold, you need a same-day appointment.
How much pressure is on the urgent care now? The doctors are full, the PAs are full. There's got to be a lot of pressure on the system at this point.
Oh, right. Well, so by 9 o'clock on a daily basis, we are out of same-day appointments. Between 9 and 10, that's it. So everything after that, we're pushing to urgent care. And, we have to try to staff up as we start sending patients that way. So, by 10 o'clock, we're already offering urgent care in Mount Vernon.
We got a Hershey doc.
Yes, sir.
Yes.
Yeah, because he's a month out. One at Henley, I think, was a month out.
Henley's about a month and a half out.
No,
And his nurse practitioner
he is even
is
the
the
same.
same. She's
Yeah.
about 4 weeks, which is a lot for a nurse practitioner. And their same-day appointments, we have slots in their schedule. Like Dr. Hanley actually has 6 same-day appointments in his schedule, and they're gone by before 10 o'clock.
Yeah.
And it's just difficult to keep up with the demand.
But the urgent care is doing a good job. I know that we've sent maybe 10 people in the last month, and they're seeing quickly, and, you know, all their questions are answered, and the benefit of that is that you know, they take all the insurance that the hospital does and the other urgent cares or ERs don't, so.
So we're seeing the internal struggle. Where are we on the medically underserved as a whole? What do they have us for family practice?
As far as physicians per population?
Yes.
Yes.
Gosh, we hadn't looked at it in a while, but we're in double digits for
Yes.
primary care, for sure.
And in community, yeah, because the community, we've had several retirements. That's not just our system.
Oh, no.
Yeah, we've talked about that, about the number of physicians that have retired outside of our own system, so the demand's there. Heavy. And we're actively recruiting. I was gonna update y'all. We saw one this past Saturday. Olivia and I came in with the marketing team, and we vetted that one.
What was the real estate team?
He was on vacation that day. I credited him. No, I'm joking. He gets a day off. And no, Marcelo's been great for all of our recruitment efforts. And we do have, I have an interview tomorrow with husband and wife team, primary care. We do have one coming in the following Friday, primary care, that would like to see us. We're actively recruiting. We actually have 2 recruitment agencies that we're using right now to try to vet and get primary care physicians here. We do have one coming. You know, we did sign one that comes in September. I know that's a long time away, but and we did vet one that is graduating the following year in 2021. We're not going to stop recruiting. That is it's our mission. So we're not resting. I don't know how many physicians we've seen in the last 6 months in recruitment, but it's almost on every other week. We have one coming in, and we're calling for people to come in and help us recruit.
It seems like there's just an unending need,
Yes.
and we're nowhere near capacity.
So we
You got neighborhoods being built new, and, you know, there's a lot of Wilson County construction that's gonna be happening.
Olivia, for the same day appointments, is that for only already seen patients, or is that for new patients as well?
Well,
Is there criteria?
yeah, that's a good question. We're trying to.
Have to know Bob.
We're trying to save the.
Can you edit that, please?
Take that out.
Sorry.
So we're trying to preserve our same day for our established patients. And anything new that's, you know, if you're calling your brand new patient to the organization, then we're gonna refer you to Lavernia and urgent care to get seen quickly. But we're trying to save those slots for the patients that are Dr. Henley and Dr. Ashenoder's, so that they can see their own physician or their partner, which is their nurse practitioner. But, you know, I mean, there's times where we do see them, but new to the organization, we're trying to send to Lavernia.
How far out is Ekmark?
Same, Ekmark,
Yeah.
Ekmark has a little more availability only because he sees a little bit more on his schedule than Dr. Henley does, so it's probably about a month, but it's still
Way out
pretty
there.
full, and, yeah.
Does
And
he have same day appointments?
He has same day appointments. So, the other thing that helps Dr. Ekmark is if they go into urgent care and it's his patient, at times they'll kind of pull him over. And so he'll step in and kind of see the patient in urgent care. So that kind of helps him, you know, take care of his own panel, which Dr. Hadley and Ashenoder don't have that luxury. But if it's his patient that goes to urgent care and the patient wants to see him, he'll pop in, say hello, make sure everything's okay with the nurse practitioner's treatment. And so patients seem to be okay with that, because at least they get to see him and speak to him.
And we really work towards the nurse practitioner. We talked about that, you know, that article in the San Antonio Express News about the primary care and the shortages they're expecting. And so we've kind of moved to a mid-level model too as well. We do have a mid-level nurse practitioner at the North Campus. We do have one that is out on maternity leave and will be coming back here shortly, I think, too as well.
She'll be here March 9th, and then Dr. Ekmark Mark does leave on paternity leave.
Yeah, that's the other.
In March, but we have a nurse practitioner, so we'll have 2 full-time nurse practitioners in Livonia covering for Dr. Eckmark while he's out. So,
We'll need both of them.
right, we'll need both of them, but
We're definitely trying to plan and where we have room, we're trying to put as many as possible. So, well, we'll continue with the primary care search, and we're actively recruiting that. Endeavor Carl's helping me out with that too, and because the applicants, you know, we're vetting them, and we want people that will work well with our system. I would like to make a recommendation, if you don't mind, on the patient experience report. I know that Mandy's on it. I know we have a reason for the inpatient recommend, but you remember we came back and we said, can we start reporting this quarterly? Because our trends were always pretty high. I think if y'all are okay with it, amicable to it, I think we should do a monthly reporting on these and see these trends. And you see an issue that has occurred, you follow it for a while, and then as you get it settled, then we can go back to a quarterly reporting. And if we see a problem, we revert back to a monthly. So if it's all right with y'all, I'd like to hit that for the next few months, and we see that trend continues to rise.
Okay.
Because you build the agenda.
Okay. Got it.
Next up is marketing update.
Did I need to sign down? Hold it up real quick, hold on.
Here we go.
Yes.
Uh-oh.
While he's pulling that up, I can get us started on the marketing efforts on pediatrics. We invite you and your families and friends to our open house to come talk with Dr. Salazar Mancuso. So I'm going to pass out these invitations, just pass them around. We're going to have refreshments, door prizes, there's plenty, if you want to take some home to anybody, and face painting for the kids, so it's a family event.
Yeah,
If you want to pass on that.
Oh, okay.
the people that I do know that have young children.
Would you like me to? If you could just.
I'm gonna drop my kids off and throw them out the window.
You can leave them on door. Leave them on doorstep, put them on windshields.
Well, my granddaughter took my great-granddaughter in for her first
Great.
well-baby visit, and she was very impressed with Dr. Salazar.
Excellent.
Everybody seems to like her a lot.
Just a preview, she's already hitting capacity. We started her slow to get used to, she's never used eClinicalWorks, that's our information system. And she's already reached her peak, and she's going to open up even more slots.
yeah,
And
she's already increased for the next 3 weeks. Well, we thought it was slow, but
yeah,
she didn't think it was very slow.
like that. So it's, she's rocking and rolling.
Yes, something cool that we did for her, sorry, did I do that?
I don't know.
Today.
I can charge them.
Who's IT?
Who's IT?
Who's IT?
Who's IT? 'Cause it's-
Somebody sitting on a mouse?
It's not mouse.
New batteries.
I got it, I'm gonna use this, I'm gonna use
Okay,
this.
you can do it, I don't want to touch the remote. I'm gonna touch it.
There we go.
For Wilson County News, she had a total of 2 week runs, both in Wilson County and Livonia News. We did something new, and we got a lot of compliments. Bob got a lot of compliments on it. You know, the newspaper, a lot of their advertisings are on a full page back or on all of the bottom. So we wanted to try, they call it an island advertisement now. So basically, no matter where you read, you have to look at her. She's staring right at you, right? And so yes, he got a lot of compliments on it, and Wilson County has never done that for anybody before. So we gave them that idea, and hopefully that could be successful in selling other advertisements.
Thank you.
Yes, they were very excited. They made it work, and I think it'll be a great thing for us and other companies or businesses
No, just
to
us.
do.
Sorry, yeah.
And nobody will, yes, nobody else will catch on and ask them if.
That was
they
awesome
can-
how they worked with us. you know.
Except you just told about Ford because we sold it.
I know.
Really should have talked about the price of that.
Sticking with pediatrics, you've seen other family practitioners and their introductory videos just telling us a little bit about themselves. And so, of course, we did one for Dr. Salazar Mancuso, so y'all just take a look here.
Hello, my name is Ana Salazar Mancuso, and I am a board-certified pediatrician. I was born in Mexico, but I grew up in Brownsville, Texas, where I completed my undergraduate degree. And I went to Texas Tech for medical school, and after that, I completed my pediatric residency at Bristol Children's Hospital in Corpus Christi. When I decided to practice at Connolly Memorial Medical Center, my husband and I decided to live in Wilson County because we wanted the small town feel of a rural city, but also wanted to be close enough to big city like San Antonio, where he currently works at for the Air Force. So outside of work, I like spending time with my family and my husband. I like to exercise as well. I also like to, put in some reading when I can. And we also like to watch sports, but currently right now we have a divided household. I'm a big Cowboys fan, and he's a New Orleans Saints fan, so that's always fun to watch. I knew I wanted to be a doctor ever since I was a little girl, and I always had a particular interest in pediatrics as well. The reason is because children are fun, and I always learn something new from every child that I encounter. And I also enjoy being a voice for them and advocate for them. So my goal for my patients is to keep them healthy from birth through adolescence and really empower them and give them the tools to live a nice, long, healthy life.
The superstar patient is Kim Jones' daughter. And I think we mentioned before that Savannah and I are getting videotaping all of the content, all of the audio, and we put them together. And previously, they have brought a company to do that. And so we get to produce those videos at no cost to y'all. I'm sorry. Of course, we posted it on Facebook. We got very high stats with a total reach of about 2,000 people. And what goes into that is how many people share it, so about 16, and a total of about 1,000 video views. You got to see the invitation that is in our clinics. It's out in the front lobby. We take it to various events that we participate in, and so we're getting the word out for them to come meet Dr. Salazar Mancuso. Also for Wilson County, they have special sections that they have sponsorships for. Connolly has sponsored the To Your Health special section, and we got the back cover. So if y'all would like to just take a peek.
How's our infusion? Is it picked up or kicked in?
It's had a lull.
What?
It's had a lull.
Confusion.
It's we're working on it, and Mandy and the marketing team have already gotten back out, and not to steal her thunder, but Mandy and the team put together a book on infusion therapy and the services we provide, and then has actually expanded the services and gone out and marketed it. Mandy, do you want to talk about it for a second, a little bit?
So yes, we're expanding the services. We put it together a whole binder to go out to all of our local physicians. We're gonna hit Seguin, Kennedy, Carson City area, Pleasanton. And then some of our physicians that come down, like Dr. Chawla, who does hematology, oncology. A lot of these patients need fluids, they need iron, they need antibiotics, wound care, long-term antibiotics. So Damon, who is running ER ICU, who's our educator, he also does PICC lines, and midline. So for people who need extended medications, that's another service that we're offering. We normally just do it inpatient, but we're gonna be doing that outpatient as well. So if they come from a doctor's office and need extended medication, they can get that. And then we're marketing our special procedures and radiology procedures, all of it at one time. We met with Conviva last week, and they were just very pleasantly surprised at the services that we can offer and meds that we can offer through the infusion center, even if it's just fluids for a pregnant woman or somebody, you know, like that. So I anticipate those visits are gonna go well. Caitlin's trying to schedule us with, we have probably about 8 different physicians or clinics we're gonna hit and go personally and talk to them, give them the resources, the book, the form, so all they have to do is fill it out and fax it. They don't have to search for them or anything. So that's what we'll be doing the next 2 to 3 weeks, is continuing that marketing effort.
I just, think we can get people in here
Yes.
to see what we're about. They'll be impressed, and I've mentioned this to several, and so if I'm being repetitive, I'm sorry, but over the past 2 weeks, I've had 2 occasions to be in the OR here. My choice both times. Don't ask me what's wrong with me, but it was my choice. And the people from, it was really early in the morning, so the first person I met with was the ER person who takes your information, and she was amazingly cheery for 6:30 in the morning. I am not. But then everybody I met with, and worked with and talked to and got stuck by and taped with, they were great. They were professional. You couldn't have told me that I was in some little, small country hospital. They were top-notch professionals, and they all seemed to be enjoying their job. They were all friendly. They laughed at my jokes, which is not easy to do. But you can hear the chatter and the dialogue between them, as they were going through their morning, that they were enjoying being where they were. And it was just, we got something to talk about. And it just, if you can't get anybody in here to see it, then I think they don't know what they're missing. But, I've been in the Houston Medical Center and, those kind of places. And they got nothing on us here.
Even the follow-up phone call you received, right? You got a follow-up from
Yeah.
visit?
From Zoe.
From Zoe, oh yes, you'll never forget her accent.
The accent
Oh, I
gets you
love
every
her
time.
accent, yeah.
Yes.
I have a quick question about the IV
Yes.
infusion. For instance, this past weekend I had a little bout of food poisoning, right? I got dehydrated, and I went to CryoFit the next morning to get fluids and vitamins. Could I have come here?
You
Without,
just need
you
a
know-
doctor's order?
Oh, you
Yes.
need a doctor's order?
Yes.
Okay.
Yeah, so you will need a doctor's order. Now, if you're established with a PCP, that's definitely an option, if you call and you want fluids. Some of those doctors will do it in their office though, it just depends. So a lot of times, we won't see the fluids as much because a lot of offices will do IV fluids in their office. Rehydrate you, give you a little bit of Zofran or something and you're good. But what we do tend to see a lot of is the older patients who live out, on the farms, who need blood, who need iron, have the chronic things, and they don't want to drive to San Antonio. They're scared to death to drive to San Antonio. So we're trying to reach out to those physicians to get those referrals to be able to let them come to us and not have to drive to San Antonio to an infusion center. So, I even had a few pediatrics that's have Crohn's or rheumatoid arthritis that we can give their biologics here too. And Irene does amazing with them as well. So, we're really trying to expand the knowledge so the physicians know. But, or you can just call me, I can ask you some fluids. Me and Sam were like, yeah, we're just cute.
We're excited to have another video for you guys, something different and exciting. This is one of Dr. Perfina and Moorhead's patients, and he'll introduce himself
Yeah, it's me.
My name is Richard Garcia, and I'm from Tilton, Texas, and I have a right foot wound. It started off as a callus and I waited 3 months before I came and saw Dr. Porfino. With my wound, I was constantly in pain and had difficulty walking until Dr. Porfino and Dr. Moyer, the general surgeon, teamed up to treat my wound. I love how Dr. Porfino is local and convenient. Every time I come to Dr. Porfino's office, there's never a wait time and the staff is knowledgeable in what they do. After my surgery, I was immediately brought to Dr. Porfino's office and placed in the hyperbaric chamber to kickstart my healing. Now that I've seen Dr. Moyer and Dr. Porfino, I'm no longer in pain and I can resume back to my normal activities. I recommend Dr. Moyer and Dr. Porfino to my friends and family due to the exceptional care I received here. If it wasn't for Dr. Moyer and Dr. Porfino, I wouldn't have part of my leg today. I will use Conley Memorial Medical Services from now on.
Some children?
Children, yes. A couple of things for home health in rounding. We have helped them design Valentine's for their clients, and they have taken these gift baskets to round and just go visit people. As well as on Valentine's Day, they took carnation flowers to the residents of New Haven Assisted Living, and of course they were very happy to see the nurses. Some of the clients or patients of theirs have of course used or have seen some of our nurses before, so familiar faces. And New Haven gave us a nice shout out on their Facebook for coming to see their clients on that day. We have talked about Infusion Center. Mandy had mentioned that we helped prepare their materials. I have scheduled them for rounding, prepared just other things that they can take to the physicians that they visit. And there's some more efforts to come, and I don't want to spoil our things for next time, but Infusion is featured on things that are going to be widely shown to the people of the community. So I will report on that next month, okay? For employees, we had our annual Cowboy Breakfast on February 6th. And every year we participate in the American Heart Association in wearing red on February 7th. We got to have a picture with Dr. Nyack, and on social media we were able to shout him out because that's his day. February is American Heart Health Month, and so we join the nation in celebrating that, as we do a lot of other things. The Consolata Golf Tournament is coming up on April 4th. I do have flyers, forms for team purchases, as well as sponsorship opportunities. If Savannah, and Veronica can all help you participate in that, so you just let us know how we can get you participating. Some upcoming events, you have the invitation for the Pediatric Open House. We are celebrating St. Patrick's Day by having just some green snacks for the employees. The Polk Senior Group has invited Conley to give a presentation, and our rehab physical therapists have agreed to do a balanced presentation for them on March 18th. And Polk Senior Group has given us a second date to fill in May, either again with rehab or something of our choice. Some of our nurses may be talking about infusion, home health. They have opened up 2 dates for us to give a presentation to their group. We are participating as well as helping arrange the Wilson County Community Health Fair and 5K on March 28th, and then of course the Consolata Golf Tournament. Is there any questions that I can answer?
Great job. I really, have to say our marketing is, the two of y'all have just done a fabulous job. I can't open up my Facebook without seeing something from you. And I hit the little thumbs up thing.
Thank you so much. Like and share.
Yeah.
Like and share.
We've hit 3,000 likes on our Facebook, so that was a little milestone we were excited for.
Yeah, well, and I have to tell you too, that Caitlin Thayer is a prodigious
Yeah.
sender of
Yeah.
stuff too. So
Yes.
I see a lot of stuff from her. All right, next up, we're going to move to the CEO report. Mr. Gillespie. Announcements?
Just a few announcements. Position candidates we've already kind of talked about, so I'll make that quick. We are ongoing looking for primary care. We are actively working with both recruiters, and so please bear with us. Marcel, be on standby for me. Please, thank you, sir. But yes, we're actively recruiting, and I want to let you know that we know that there is a huge need. I get daily calls on it, and I want to reassure patients or residents of Wilson County that we are trying to work to help meet that need. The MOB build-out is going on. We talked about that already, but looks like we'll have movement back by April sometime, and so we're kind of excited about that too. Hope to show it at the next board meeting. The upstairs is probably within 2 weeks of finishing up, and the downstairs was within about 3. So
Three after.
Three
behind.
after.
It's 3
Okay.
behind.
3 behind, okay. So, in about 5 weeks, so hopefully that'll all come to fruition. This looks really nice. Just to talk also about call center, we've heard things about the call center. If you hear anything about the call center and improvements that we need to make to help streamline it, it's knowledge, and with it being inundated with a number of phone calls, we're not on that phone or on that call tree all the time. We heard of a few issues, and Brandon and Olivia have really gotten together with the team and streamlined some of those services too. So that's been ongoing too, that improvement. Olivia and her team actually attended eClinical Works workshop, and they actually are looking at, eClinical Works is our information system for the hospital, for the clinics, and they actually had eClinical Works come in and look at our systems and see how we are utilizing them and if we could have any more efficiencies. They alerted her to several areas that could be improved upon, and they're coming out in the next few months to help us out to even improve eClinical Works even further. So we're always working on quality. We're always working on those quality systems and our foundation. That's very important to us. Urology, this is just a picture of Dr. Morales, if any of you haven't seen him. He'll be coming on board. One of the other specialties y'all have asked us to bring on board is dermatology. So when I was over at the NICS, I happened to meet Dr. Rainey. She won't stay part of her own system, but I encouraged her, why don't you come down here and rent some space, at least some space in a multi-specialty clinic. And I've heard great things about her. And so she came down and she was very excited. And so she's waiting for me to send her a lease agreement. And her husband is also a dermatologist and is in the military at present. So they would like to expand down here 1 to 2 days a week, whatever.
Right.
So we will have a dermatologist operating within the confines of Conley Memorial here shortly. So helping to provide necessary services for Wilson County. So news to come. So I'm very excited. It was a great meeting. So with the team. I just want to reiterate what Carl said. This year has been a great year. It's been an honor and privilege to be in the position I'm in, and I couldn't have done it without everyone. I mean, I can't, Kyle, Olivia, Brandon, Andy, of course, you have helped me out quite a bit. Endeavor has been, Endeavor, Carl, and Curtis, pause.
He paused.
Sometimes, the age is getting there, I need a little bit of memory.
I have to put Brandon on the spot. Is he finally letting go of stuff?
We're recording. Delegation dump truck.
We were worried about that he wouldn't let go of things.
Show him your list, Brent.
Yeah. Oh, so he has let go.
Yeah, my OneNote is heavy, yes.
Oh, good. It's good to hear it.
I'm learning.
Good.
So, but with the team, I mean, it's the physicians, with the growth, surgical services, rehab, imaging, laboratory, the Endeavor team. Carl, he's there. I must bug him at least 3 or 4 times a day sometimes, text messages, phone calls. Curtis and his team working on the financial portions and the billing. I mean, I go on Kyle and his team and the finance department, keeping us straight, making sure we're meeting budget. It's just been an all-encompassing effort, and it's just been an honor and privilege to be a part of it. This was a very good year, as you can see. If you noticed comparison to other hospitals, Carl alerted me to a CEO group, and you hear the screams from other hospitals. You know the problems that are happening. And so it's, you have a great hospital, and that's why I've been here so long. I believe in this place, I believe in the people. And so this year is also looking good going forth, so we hope to have many more good years. Know the mission, and that is to bring on more and more physicians and grow those service lines too as well. And we'll be looking to the future of healthcare too as well. Carl and I had extensive talk about that and where we need to be looking 5 and 10 years down the road. So heading that way. I'm going to turn it over at this time. The next part is one of the subs of our area is the employee engagement survey that we had. And I think that should come from our HR director and Newt Sandoval, our Newt. He was actually the HR director, and when I first got here in 2005, he went out and worked for many other companies. I can't name them all, but government agencies doing HR. And he's from Lavernia, or living in Lavernia, living in Lavernia, and when he heard we had an opening, he came back. So I'm going to try to get it converted over where it doesn't feed so fast.
I'm very glad to be back. It's nice to be home again. Basically, I'd like to briefly kind of discuss, present to you what our results have been for our most recent employee engagement survey, which was conducted the latter part of last year, November, December timeframe, and just kind of show the data that was brought to our attention and some of the areas that we're going to be focusing on. Basically, we invited about 271 employees to participate in our survey this past year, with a response of 167 employees, which came out to about 62% response rate, which is actually pretty good because typically for most surveys you're usually seeing between a 30 and 40% response rate. So that was a good response, and hopefully next year what we're going to plan on doing is also including our pool personnel. We didn't this year, but we're going to be including our pool personnel. So we're going to be including all of our employees because even though they're not full-time, we still want to see what their input is so that we can better our overall employee experience here at Conley.
Kind of cut off there.
A little bit larger than, but basically these are the different areas that we're looking at as far as we have an engagement indicator, team index, leader index, looking at overall organization, our managers, our employees, and how we're doing with the work-life experience within the organization. What I'd like to do is go ahead and kind of briefly discuss each of the different areas just to give you a little bit more information so you know exactly what it is that we're looking at. So as far as our engagement indicator, the engagement indicator is a composite metrics of 6 items that measure an employee's degree of pride in the organization, intent to stay within the organization, willingness to recommend us, and overall workplace satisfaction. Right now we're at a 4.01. Basically the rate scale is anywhere between 0 to 5. So overall we're just under the national average at the 30th percentile for this particular index. And if we're looking at the, as far as the, if you're looking at the full metrics for each of these different tiles, you're going to note, and you take the percentage average for each of them. For this particular one, we're actually at about an 85% positivity rate, or 85.5% positivity rate for the particular index. Next, we have our team index, which work groups are designated as Team Index 1, Team Index 2, Team Index 3, and these are based on items from the, basically the survey that we conducted. The Team Index indicates the level of team functionality and visibility. Scores in this index indicate the level of support needed to effectively drive improvement and positive outcomes. What this is indicating is the areas that need possibly additional assistance in improving their particular areas or departments. If it's Team Index 1, basically these departments don't really need a lot. They just need some assistance as far as to help improve processes and improvements. Whereas when you get down to Team Index 3, those particular areas may need a little bit additional support in order to try and bring up their overall scores and improve the data that we're getting throughout the year. So hopefully next year, those in Team Index 3 are going to be moving more towards the Team Index 2 or the Team Index 1. And that's our goal for this coming year. As far as the Leader Index illustrates how well prepared the work group leader is to manage a work group through activities that support improvement and positive outcomes. The key metric provides insight into leader-employee relationships by measurement, trust, respect, communication skills, and openness to discuss issues and solutions. Basically, this is showing a pretty good index as far as our overall leadership within the organization. Anything basically above an 80 or higher is basically on the higher end of the scale. And so overall, our leaders and our managers are doing a good job in leading our employees within their different departments. Next is our organization. Items in the organization domain measure the degree to which employees feel connected to the overall organization. The domain relates to broader perceptions about organizational culture. This is probably the one that we have to work on the most at this time. Right now, we're just a little bit below the national average at 3.8. And we want to try and get that back over 4. So hopefully on this next year, that's one of the things that we're going to be focusing on to try and improve our overall culture for the employees and get them more involved within the organization. Next, we have our manager index, which is items in the manager domain reflect the degree to which employees feel connected to the person that they report to, typically a supervisor or manager. Again, this kind of goes back to the leadership index that we saw a little bit earlier, and we're above the national average for other hospitals that are about our same size nationally. So we're doing real well as far as our manager index. Next will be our employee index, which is items in the employee domain reflect the degree in which employees feel connected to their colleagues and their job. So with this, basically, we're just below the national average, but still well within the range. Again, if you take all the metrics associated with this particular index here, basically you were looking at it still about an 81% positivity percentage on this. As far as the resilience index, this measures the ability of the employees and physicians to recover and remain engaged with the challenging work circumstances, provide an early warning system for burnout, so we're looking at possible turnover. And the index is divided into 2 themes, which is activation and decompression. Activation items focus on finding meaning in work and focus on patient clients as individuals. And decompression items focus on the employee's ability to disconnect from work. So basically what we're looking at is work-life balance that we're providing for our employees. And overall, again, we're just below the national average, but still well within the range. And we're continuing to try and see what we need to do to help improve that work-life balance for our employees. Try and help them once they get away from the work site to be able to kind of leave it behind until they come back for the next day. Within the system, we can also look at specific items to help to see about improving. This is just a short example of some of the areas that we look at. We can look at our specific strengths that were indicated by the employees that we basically want to focus on to try and continue to improve. And then on the next one, we can also look at specific concerns that the employees have brought to our attention, and we can kind of focus on those. And the good thing with this is we can actually click on the bars and see exactly what areas we need specific improvement in. So it kind of helps us focus down where we can see where we need to kind of focus our improvements in which departments and possibly even which managers we need to kind of work with. And lastly, we have basically where we had questions, open-ended questions that we were able to ask the employees as far as what do you like most about the working with the organization, as far as positives, and that way, this is basically the employees' specific statements where they can openly add as much as they want. And then same as, please provide any suggestions on how we can make the organization a better place to work for you. So with these, if there's anything that you see as far as a trend, that helps us to focus on what we need to work on in overall improvements for the organization. Okay. Any questions?
Yes.
Yes, sir.
The index for the culture was like a 3.8.
I'm sorry? For the organization?
Yes, sir, for the culture, or organizational culture.
Mhm.
What strategies would you, work to improve the culture of the organization?
I think a lot of that is going to be, as far as the overall, the different areas, particularly those areas where there are specific concerns for the employees. If we focus on those and improve the overall concerns that the employees have, that will ultimately end up increasing the culture index on that also. So that's kind of what our focus is for right now.
If I can interject here a little bit, these are actually good examples right here. So these are the concerns of employees, and I'll go over them just a little bit, what we've already strategized. So Noob's heading this project up. And so within the system, this is a brand new system for us that actually gets down and pinpoints questions, and those questions can actually focus you in suggestions on how you improve your organization. So we've never had this system before. And you can do deep dives. We can't get down to the actual employee that actually said what, but we can say in general this area. It can be a nurse, it can be a medical assistant, it can be a lab tech, it could be administration as a whole. So this is some examples here. The organization provides career development opportunities, okay? And the next one, well, let's just say that one. The organization provides career development for opportunities. We actually sat down as a team, executive team, and talked about all the people that have moved up through the ranks here at Conley Memorial. We haven't gotten that message out. And if you've noticed through Facebook lately, the marketing team has actually started strategizing some of that, and we have what we call pathways. And so pathways, you've seen through the Conley website, we've showcased several individuals that have been recently promoted within the organization. Caitlin Thayer was one of those too. She was an LVN here, or an RN did she start as? I apologize.
She started in health
Yes.
as an LVN.
As an LVN. Moved up to RN, went on to ER, became the ER supervisor, and is now the administrator of home health. Manny Sarala has moved up through the organization. I can go throughout this organization and name many individuals.
Bob Gillespie.
He was the janitor.
He's the poster child, right? You too can be the CEO.
That's the next video.
Please no. Please no.
I'll fund the production of that.
Thanks, Sam. Yes, I know you got my back. So, but no, we need to let people know. I don't think people know there are pathways here to move up within our ranks, and we want to showcase those people. We heard the message that was sent out here, and so we worked on that. Different work units work well together in this organization. Great, I need to know that. So what we did is we started structuring quality based on this too as well. We focused in on process improvement and committees to actually, somebody just doesn't go to somebody's office and say, I have a problem. They bring that to quality. There's this problem. There's a process that's broken here. We bring the teams together. Brandon, Olivia, Noob, all of us, we all get together and we formulate who needs to be in those committees, and we figure out that process improvement so that the teams are working well together and they have buy-in to that process improvement. So these are slow, methodical processes we are building and listening to what is being said here. And so Noob is heading this up over the next year. And in this system, you can track it. You can identify that this process improvement needs to occur with a particular manager, executive, and they build the process improvement, and then they report on that process improvement, whether it's weekly, if it's a big concern, monthly, quarterly, and show the progress of that concern.
Those plans can actually be input into the system also for tracking, so everything's all in one place.
This is another big project we are working on. So when you see, this is our baseline, new system, how we work, and we want the truth. You know, when you fill out this survey, it is confidential, and if there's too few people within a department, there's 3 or less, we can't even dive into it. Okay? And we won't utilize that information. We want people to.
Sorry, I had to laugh.
So,
There's only
yes,
3 of us.
at the time, yes. Yes, there's only three of us, so we can't dive into your area. But we can dive into the executive as a whole and say that we have some areas that we do need to have concern with, so that we need to look at. And so this is very important to us as an organization and improving our organization even further. And thank you for heading this up. He headed it up, made sure all the questions were there. He's the one that brought you the resiliency index. This is kind of a new index for us too as well. If you notice when we got to that, sorry. So the activation was high, 4.6. So everybody, as you said, they love their job. The problem they had was decompression at a -0.12. So we got to focus in on that part too as well, that you can get away from your job. That you don't have Kyle calling you at all hours of the night at midnight saying, hey, tomorrow is a big day and we got to get this done. We got to make sure these blocked, you know.
Decompression can also be, if you go home to an environment and you've got 3 kids under 5, there's no decompression time, except for like between quarter to 11 and 11.
Decompression could be actually coming to work. That's what it's about.
Well, yeah, exactly. So it's, it depends. Different parts of life have, I mean, I'm at a point now where we're kind of empty nesters, except they keep showing back up.
Yeah.
But still, I can decompress. Of course, I work from home, so it's just go from one room to the other. But I mean, that's a lot is about life. What do you do about life? Deal with it.
I think the fact that we're looking at this, tracking this, analyzing this, trying to make it better, says a lot for the organization, because there are a lot of organizations that, that's your job, go do it, and, who cares about the rest of it? But I think it's important to work on the culture, to build the culture, and to be aware of what's going on. And hey, this is great. I think this is a good system, and it'll indicate where the problems are, if any, and work to improve them. So, the fact that we care enough to do this is important.
Interesting fact, just to share with you, for me, is at times we're also looking at those that have higher scores as a whole. So if you, one area, we dove into the executive and then the managers under there, and one of the managers, everyone in their area were almost all 5s, 4s and 5s, very high. And some of the others were lower. And so if we can take that manager, what are you doing to talk to your individuals? Are you communicating with your individuals more often? Positive communication? Or we have leadership meetings every week now on Monday. And so we disseminate information to all the leadership. And I bet that leader is going back and disseminating information to the folks underneath them. And so sometimes it's communication. And so those are some of the things we dive into and speculate, and we'll go talk to that individual and that manager. What are you doing differently than others? And so great learning experiences and sharing of culture.
I guess where I'm having just a little bit is for corporate identity or culture.
Yes, sir.
For me, I think of corporations or organizations like Saturn. There's a specific feel that they have. Apple. And I even think of Raider Nation. There's a team, it's like, I just recently became a Raider Nation. I like their clothes, I don't know anything about them. I just like their clothes, or a hat. Anyway, that's what it's kind of weird because it's not anything that, for me, it's just a feeling, or it's like a mode to be like, I work at Conley, I'm special, or that's what I'm looking for, or just thinking about. But because I think Larry, I'm just something he said was making me think of that when I think of culture. But anyway, just like a sports fan, or I don't know what I'm trying to say, but culture for me is just a flavor, a color, a style.
Sense of pride.
Yeah, exactly. Just something that you want to be a part of Conley, and you know that you are. So anyway, this.
Hourly not swim help and puppies.
Actually, Mandy sent me by Facebook the other day that one of the hospitals in Houston had a nurse decompression room in the ED.
With puppies?
They have sunset views and little birds that fly. And yes, they listen to their individuals. I'm not saying this, but I won't go.
Right, right.
But yes, there is a culture, there is a feel. I can tell you right now, this, you know, Brandon and working with dietary and working with the team with HCSG, just the food has improved. Am I wrong on that? I mean, the food, they make homemade egg salad. That food makes people happy, and the options that they have, and so they, yes, sir.
I also think we're trying to promote the Your Hospital.
The Your Hospital.
And
This is,
that kind
Buy-in.
of comes with a culture, right?
Yes.
Your
Okay.
Hospital, the community's hospital, and our hospital.
Pride and
So-
Your friends, your neighbors, you.
that, see, look, they're already getting it. But that's when I go talk. We're taking care of your friends, your neighbors, your loved ones.
Yeah, so we want the employees to feel that as well, that this is your hospital.
Right.
You know, you enroll in this
I
and
think
that
it
culture.
would be important.
That's what
for-
I was, that's exactly where I'm
Right,
thinking.
right,
Yes.
so
Get
that's
creative on it, working on
kind
that.
of what we're trying to do.
They're gonna make me cry.
We can be like Rackspace
See,
where
look,
everybody has
it's
to
on
have
our birthday.
piercings in the
Your hospital.
ponytail.
Well, it's similar, I mean,
Important
tech
that
companies
employees
really
understand
build it up
what
and
authority
it seems to work.
Right.
And they work for a winner, they work for an organization that's moving forward and progressing and, you know, that is on the cutting edge.
And they're getting part of the bonuses,
Yeah.
and those messages are getting out. And I think there was some uncertainty from the past, let's just be honest, you know, and so we're moving forward. And that's the main thing, we're getting the messages out. And sometimes it's slow moving, and they have to see that the executive team, the management is in on it too, and for their success. And sometimes we aren't getting the messages out. I mean, I would have never thought that anyone wouldn't have seen all the promotions. Our central supply clerk, Melinda, the director of laboratory, Abel, all the people that have moved up through in the organization, but they haven't all seen the pathways. Not everyone sees the pathways. And so, and then we're gonna look at it as far as,
A lot of people want the pathway to reach out and grab them by the back of the neck and drag them down it. But the thing is, if you look at the people that have moved, they took initiative. They had ideas. They wanted to move forward, and they took advantage of what's here. But there's too many people that just want to sit there and expect it to happen. And no matter what you do with those people, they're not going to buy into the whole concept because it isn't happening for them.
we looked at promotions from within our marketing team, all coming in here. You know, clinic system, Savannah, I can't say enough, you know, she's moved through the ranks through helping home health and coming in and then finally being a marketing supervisor, so.
I think she's found her niche.
So we just haven't gotten that message out, I don't believe, and that's on me. And so, but the team is helping me out, getting that message out. It's not just me. I'm actually, you're gonna make me cry thinking that y'all know the Your campaign and taking care of. That's the message we're trying to get going. I'm sorry, but it's good. Brandon even did it, so that's awesome.
Tom used the word that we need to focus on is the niche. You know, I watched a niche, so to speak, from another hospital system today, we utilize this resource in a totally different department. But I've watched them grow this niche throughout the system. And it was for the employees, for a specific department. Now they are spreading to other departments. I'm not saying to follow that one because it's quite costly, but it works.
Yeah.
So it's a niche,
Yeah.
and it's finding that niche.
Yes. We're gonna be open to show you the actual results and how we're gonna work to improve it. And again, Luke's gonna help me out and the team will make sure we follow through.
Appreciate it.
Good job. Good job.
You done?
I'm done.
You are done.
All right.
I'm done with that part. So, Board of Directors of Wilson County Memorial Hospital, UVA Conley Memorial Medical Center will now go into closed